Hello, I'm Robert, helping you if you're scared of many things and by connecting you to the good information. And this is about the so-called Freedom Day in the United Kingdom. If you're in the United Kingdom tomorrow now, on the 19th, then please be super careful. This is Saturday, has had the 5th highest number of cases since the pandemic began on a single day. This means that if you are a young person in the United Kingdom or anyone who has not been vaccinated, this is the 5th most risky day for the average person. Some people have been much more risky, some people will be less risky if you're lucky to be in an area where it hasn't surged. But in so many areas like the northeast of England or whatever, be very, very risky day to remove your masks and to go to a disco or nightclub. And so if we go and look here, this is what happened in the Netherlands. On the 3rd of July, they reopened the nightclubs. It's a big nightclub scene in the Netherlands. And in the next week, it increased fivefold, from 100 cases a day to 500 in just 1 week. And so they're now closing all the nightclubs and they are putting in restrictions and things. United Kingdom is opening the nightclubs for the first time for a long time when the cases are very high, the 5th highest they've ever been, and increasing rapidly. This makes absolutely no scientific sense. And here's a long thread I did as an expert. Here's an expert talking about it. And he says that he reminds us about long COVID. And young kids can get long COVID, even under 18. It's the main risk if you're under 18. And most people, about 4 out of 10 of those with long COVID still have it a year after they first got infection. And the experts don't know how long it's going to last because it's a new disease. They would be disappointed. One expert that was on the BBC said he would be disappointed if most people don't find it clears up in 2 to 3 years. But some people have had brain damage. Some areas of their brain have shrunk as a result of long COVID. And this shrinking is, the brain heals much, even in children, the brain does not heal as well as other organs. So this may be a much longer term problem for some people. And they talk about their fuzzy thinking, not being able to remember things very well and so on. Then that may continue for a long time for some young kids. And this is an example that Dr. Rachel Clark, who's one of the people I follow, and she's a palliative care doctor in Oxford, who was called in to help dying people with COVID, and has been doing that through the pandemic. And she tweets the story that the BBC did. It's a young person who didn't get vaccinated. And he says it's the biggest mistake. Not having the vaccination was the biggest mistake of my life. So, and she says, please get jabbed. For some reason that's a broken link there. We do have these marvellous things coming along. Indeed, for kids, well, the vaccine has already been authorised down to age 12 in the United Kingdom, but for some reason, even immunocompromised and very vulnerable kids under 15 are not able to get it from the NHS. And you can't buy it because its emergency use authorization means that the drug companies can't sell the vaccines directly to the public. They have to go through a government. And the NHS is not providing vaccinations to kids under 15. and some of the doctors I follow on Twitter think it's absolutely scandalous that young kids with an approved vaccine are not even permitted to get it if they want it. At the risk of long COVID, and then some kids sadly do die. We've had, I think, 25 in the United Kingdom total through the pandemic, so it's a very low risk of dying if you're a kid. We have had, I can't remember the number, it's much higher than that. It's a couple of hundred or something. There are kids that have had to be in intensive care units since the beginning. But, and then there will be a large number for hospitalisation, but it's still very rare for kids that you get any of that happens. And most kids don't get long COVID, but an 8%, that's nearly 1 in 10 do. And if I've got this thread about international experts, I could maybe do that separately, a video about that. And this is an example. Dr. Gabriel Scully says, I've been a public health doctor for 40 years and never heard of a public health strategy like this. And a lot of them just incredulous that our chief medical officer is standing beside the Prime Minister. Prime Minister, you can understand, he's a politician, he's not trained as a doctor, he's not trained as a medic, he's not trained in science. But how does a trained doctor stand up there and not immediately resign? Quite a few of the people I follow just say, I would resign in that situation. Because what they're doing is going against the Hippocratic Oath, basically. They're knowingly supporting something that they know is going to lead to lots of people becoming sick and lots of people dying who didn't have to. Because there's absolutely no reason to remove masks. And people aren't going to. Okay, it's very frustrating for young kids that they can't, for young people, I mean kids, but youngsters in the 20s or 30s, whatever, that they can't go to nightclubs. But compare that with the mental health issues of someone whose parents have died, of someone who's been sick with long COVID for a year. And we're talking about 8% of the kids who get COVID, and that's going to happen to them. And surely you can manage another few months without your nightclubs that you're so used to. So to understand, it's terribly frustrating, but it's just very important to control this really very serious disease. So do be careful tomorrow. If you are in the United Kingdom, it is not safe. It is the very worst time to remove your mask. You couldn't have chosen a worse time in the entire pandemic so far, except for 4 days in whenever that was. Those 4 days would have been worse times to remove masks, whenever it was. So I've looked at, I can't see. I'd have to get my glasses. Just a minute. I'll check my glasses. What date it is? Yes, 8th of January onwards. The 4 days from the 8th of January are the worst days for removing your mask than today for your average person in the United Kingdom. Only 4 days in the entire pandemic that were worse days for doing this. And we've got these vaccines coming along. Even in just as soon as September, they'll be able to vaccinate down to age 2 with emergency use of Pfizer. And then 6 months sometime over the winter. And this is an expected date, they don't know for sure, but it's very likely. And we have a light at the end of the tunnel. And we have these marvelous vaccines coming along, just absolutely incredible. The serology testing, yes, I'll just pop through to that in a minute. Let's pop through. So let's have a look at some of these stories. So right now school is okay. If I compare with before, I have to take a break. so I'm very tired during the day. So I have to sleep at least once a day, even at school. I will be tired and dizzy, but I found a place where I can rest at school. That's a boy aged 13 with long COVID. It was hard to be away from school so much, and it's really hard where it hurts so much, but I manage. I do well in almost all subjects. A boy aged 11 years. It's 2 out of 4 in the family, and those 2 can't do what they used to. I have to take it up. It's hard, but it's worse to be sick. I miss how it was before. They say that children are not affected, but then I'm a child, and I've already been affected. Hello, why do you never say anything about it in their meetings? It feels so warped, really warped. And I'm used to having my mother, and then when I realised it could be this really long, after 2 months I thought, I really panicked, will she be like this always? It's a new disease. It's scary not to even know if she is getting well, because if the mother gets long COVID, the doctors literally can't say, even for sure, that she is going to get well. They think it's likely she will in 2 to 3 years, but with a new disease, they don't have that experience to be able to say for sure. So we are risking large numbers of people with long COVID, an unknown disease, very little knowledge of what happens long term if you've got COVID. Certainly we are risking we've got these years of life of children, and none of this needed to happen. None of this does need to happen. It's just so frustrating. Just incredible. I've never seen anything like this in my entire life. I've never seen anything so unscientific as our government has been all the way through since March. And they haven't listened to other countries. In March 2020, March 11th, 2020, and if you've been following me, you may remember I was writing to everyone I could, to leaders of all the political parties, never heard back from any of them. They must have been swamped with emails. Published a letter in Science 20 to Boris Johnson saying, please go back, don't stop the test, trace, isolate. When he did, people forget now, but we did test, trace, isolate through to March the 11th, 2020. I think that was the date, when suddenly the United Kingdom stopped it. And people were saying to me before that, I was helping people very scared about all this, and they were saying before that, they're worried that they might drop test, trace, isolate, and I said, no, they can't do that. And they didn't make it clear that that's what they were going to do. That's what they did. And I've been following what was happening in Italy, and we were only at a few. China had been test, trace, isolate, I think tens of thousands of people. The United Kingdom was a few dozen at that point. They said, we can't cope, we're overwhelmed, we're going to stop. And then they only came back to test, trace, isolate at the end of the first wave. And it's all the way through, one thing after another. It's just basically not driven by science. Now, the vaccines, the United Kingdom has been really good. So the AstraZeneca, and on testing, and on full genome sequencing, and they're just bringing up a new lab to do this full genome sequencing. So although the one thing we will have is that if a new variant starts, we've already got Delta Plus, and we've already got the Lambda, and they're just variants of interest. We don't know the variants of concern yet, but we are pretty certain there have been 4 variants in the first 100 million people. There have been another 100 million people since then. It seems very likely that there are more variants that have incubated since then, as somewhere around in the world, that are going to start spreading, that have maybe already achieved some vaccine escape. It takes a long time for an exponential to start spreading around the world. The Delta variant, they think, started in October 2020. and yet it only really became a serious concern, the exact same virus, just very minor changes in late spring 2021. So there probably are other variants already circulating somewhere in the world that just haven't hit the conditions, or they're just very, very slowly increasing. Exponential starts so very slow, and then they just haven't hit the optimal conditions to start spreading. And they're all going off on holiday, and then they're going to come back, and then some of those people they're like petri dishes going around the world to gather variants anywhere they find on their holidays and bring them back to the United Kingdom so that they can start growing here. And if there's anything out there, if there's a variant of concern that hasn't been detected yet, then all this travel is being encouraged, all the take moving countries so that we can travel more easily for our holidays. So again, be very, very careful. This is the most risky time of the entire pandemic so far, the next few weeks. Really the worst possible time to open up. So please, on a personal level, be very, very careful. Now we have these wonderful vaccines coming along. We've already got wonderful vaccines. We've got vaccines targeted for the variants. I think that's again sometime about September or so. We'll start having the first vaccines that are targeted for Pfizer. I think has already started trials for the Delta variant targeted vaccine. We've already got vaccines that's been in trial for a long time that target the beta, and that's quite useful. And beta and a number of things that are in the beta and some other variants, but mainly the beta virus, which is the South African one, has got a number of things that enable vaccine escape. So a vaccine against that helps a lot against lots of variants, not just that one. It'll help any other variants that use those same tricks. And then we have the Gritstone Bio vaccine. That's in phase 1 at the moment, but that targets the insides of the vaccine. So we have the two ways of cancer vaccine. There's stopping the antibodies, then then there's killing the cells that are making the vaccine virus. That's killer T cells, and some people think those will be much more effective. We also have the hexapro tweak, which is a way of making the vaccines much more stable. Anyway, there are loads and loads of really astonishing things coming along. I didn't mean to talk about all that so much. So I just want to end with a positive, that we do have the light at the end of the tunnel. The World Health Organization is absolutely clear about that, and they're just this time next year, the situation should be hugely changed. Vast number of vaccines. Vaccines are very easy to make. Vaccines that grow in hen's eggs, like flu, but 5 times as many in the same egg, 5 to 10 in an egg instead of 1 or 2, and using this hexapro tweak. And that's a vaccine that's being developed it's called Butan Black in Brazil, and it's also in Vietnam. It's being developed, and where else is it? No, Thailand. I can't remember. It's in several different countries. I think Turkey's doing a vaccine. So lots of countries that don't normally make vaccines, but the University of Texas has licensed the hexapro tweak, and this is giving them the intellectual property to make these vaccines, which are going to be coming along later on. So by this time next year, we should have lots more vaccines. We've already got 30 in phase 3, over 30 in phase 3. Many of those will be approved. And then we've got all these other ones coming along that are in phase 1. And by this time next year, there'll be all those as well. And amongst all those vaccines, there are bound to be ones, if they're trying so many different ideas. And the technology has moved forward hugely in 1 year. It's like Brian Cox, after interviewing some experts, he summarised it as about a decade's worth of vaccine development in 1 year. Because of all the finance for it, all the interest, there's the collaboration, very open research, instead of the researchers being stuck in some particular drug company, but they're all talking to each other and sharing everything they have. Very, very open way of researching. There's these, and then huge amount of funding, and then because it's a pandemic, the vast numbers of people getting sick, and this means that if you do trials, and also lots of people volunteering for trials because they know how important they are, and then lots of people getting sick, which means you get results very quickly from the trials if the vaccine works. Then you soon discover that it works because the ones in the placebo group get sick. And then now they'll be probably comparing them to other vaccines that work, so you can see if the new one works compared to the old one, because it'll be very obvious very quickly if it doesn't work, because you start getting people getting sick who've been vaccinated with the new test trial vaccine. So there's therapeutics coming along as well. Huge amount of effort. It's very difficult to make therapeutics for COVID, such a complex disease, and to treat. But we are getting some progress there as well. So there is a light at the end of the tunnel. And in terms of the United Kingdom, we can have all the adults. We could have, if they just do it, so 12 to 15, and each year group is only 800,000 from 12 to 15. I'm sure there'll be a huge uptake at that age range. The parents will be very keen, and the children, and so it'll probably go very quickly. And if you've got a reasonable uptake, we can vaccinate 400,000 a day or more. I might have higher than that. So that means each year group only requires 2 days. So 12, 15, 12, 13, 14, 15, that's 4 years, can be vaccinated in 8 days. Then you have 3 weeks, and then you get the second dose, again another 8 days, that's them all vaccinated. And and in September it'll be approved down to age 2. So that's another 2 to 11. So that's 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. So that's 13 years. So that will be another 26 days. You could vaccinate all of those. And then 3 weeks later, another 26 days. So we could easily end the year with, you'll be well before Christmas. We could sometime in October or something. So sometimes in October, and then another, and then near 3 weeks, November, certainly well before Christmas, we could, if we wanted, have everyone vaccinated down to age 2. And I mean, at the same time, we have to make sure at the same time that we are going to have vast overabundance of doses by the end of the autumn. So that is not, at the same time it's very important to vaccinate the whole world. And I think it's something like 2 billion extra doses that the wealthy countries have got in advanced pre-orders on through to the end of 2021, which they're definitely not going to need. That's even with 2 doses of the booster. We've still got 2 billion left, and that's just the United States and Europe, United Kingdom. It's not everyone. I think that there's more than that. I think that's the United States and the EU. I'm not sure. Might be no, I can't remember now. But certainly amongst the wealthy countries, there are going to be enough doses to double vaccinate 1 billion people at least by the end of the year, in addition to their own populations. And then there's many more vaccines coming along. And by the time we get to 2022, then the vaccine capacity is enough. So we could be vaccinating, making 1 dose for everyone in the world on average every 3 months throughout 2022. and that capacity will only increase. And with more effective vaccines as time goes on. So you can see the vaccines are out at the moment, but at the moment, right now, Delta is so, the vaccines we have at the moment, Delta evades them, especially for infection. So I was listening, I think something like tiny reduction, 4% or something, and then 84% reduction. And one of the people I was reading was saying was the reduction if in the transmission, if you get infected and then you transmit to someone else. And that's just barely, even if everyone was vaccinated, then that would not be enough, or just barely enough, or not enough to stop it through vaccination alone. So even if everyone in the United Kingdom has the vaccine, that will greatly reduce the deaths and hospitalisations, but it won't stop it surging like it is at present. It would just go on, and it would have no greater than 1 unless you do the other measures. So the experts say we definitely have to do the other measures, like wearing a mask, and definitely wearing a mask, and the test, trace, isolate. That can take up a lot of the slack. And if we do supported isolation, especially once numbers go down low again, and wearing a mask, then that can take up an awful lot of the slack. And it's almost as good as a second vaccine to do that. Especially if you isolate people away from others in their own household. If you give them the opportunity to do that. Some, especially deprived areas, it's very difficult to isolate away from their own family. And we could also try things like wearing masks at home. So even if you're double dose vaccinated, remember, double dose vaccinated, you can pass it on to other people with Delta, and you have only you have a tenth of the risk of dying. But for an elderly person, if your risk of dying is 20%, a tenth of the risk is 1%. That's still significant. So we don't know for dying. The risk of hospitalisation is reduced by a tenth. Risk for dying, I think, is more than that. It's more like a 20th, according to some figures. But still, 0.5% is still a significant risk, 1 in 200. So, do continue. So we do have to continue these measures. We can't open up completely if we are responsible, but it's very advisable to continue to wear a mask and continue to do whatever physical distancing you can, continue to work at home if you can, all the way through until we have new vaccines that can target the variants. Because right now, we don't have vaccine with Delta. We just don't have a vaccine that can stop Delta through vaccination alone. We have to use other things. And if we had a very good test, trace, isolate, that can take up a lot of the slack. We don't in the United Kingdom. And then we also have to have masks. And in Taiwan, one of the experts from Taiwan in the summit yesterday was saying that in Taiwan they have all kids at school wear masks, and they have specially fitted small sizes of masks for young kids. And this whole thing about it damages their mental development, I don't think there's much evidence for that. I mean, if you think about it, and there's emotional expression in the eyes. So if it's all just about, kids mustn't wear masks because they've got to learn to read emotions. But maybe wearing a mask will teach them to be able to read more subtle emotions because they're having to learn to read the eyes. So I don't think there's a very strong argument there. I mean, in plenty of, like in Taiwan, they're all wearing masks and they obviously don't think that it's bad for their kids' mental health. So, just, I personally think all the kids should be wearing masks. I mean, look at it. The main reason the cases are going down in the United Kingdom is because schools are have closed for the holidays. So it's gone up to a peak and now it's coming down, and likely go up again when children return to school, because we don't have adequate measures in place in schools. And it just doesn't make sense to have kids not wearing masks in schools, not physically distancing, not even isolating properly, as it's going to be in the autumn with our government's plans. The government called it a fire break. Now the summer is a fire break because the children won't be at school. So if that's a fire break, then schools are a fire. And when there's a fire going on, you stop it. You don't just say, oh well, this fire is going through the forest, but there's a fire break, so we're okay because we can stop the fire break. If you can stop the fire going to the forest, you stop it. You don't just let it go until there's a fire break. And so they shouldn't let the disease go through the schools just on the basis that yes, it's going to slow down a bit over the summer because the children are going on holiday. So just let it go through the schools until then. I mean, it's deeply, deeply unethical and immoral. And the thing is that when you're dealing with health, if someone is sick now, you save them from their sickness now. If someone risks dying now, you save them from dying now. And you wouldn't say, for instance, to a cancer patient, well, it's better if you die now, because if we preserve your life for another 3 months, then you'll die in winter when the hospitals are full of people with flu. You wouldn't say that. If you can save the life, even if you can prolong the life of a cancer sufferer for 2 or 3 months, that's 2 or 3 months for that person. If you can delay long COVID amongst young kids for 2 to 3 months, that's 2 or 3 more months that young kid doesn't have long COVID. So even if there wasn't a light at the end of the tunnel, and even if we knew it was going to surge at the end, which it isn't, and there's no reason for an exit wave. I mean, some experts, another of the experts I was reading just the other day, they'd never heard of the term an exit wave. It's not a standard epidemiological thing that you have to have an exit wave. New Zealand didn't have an exit wave. China didn't. We got people, I remember back in spring 2020, we had people in the United Kingdom saying China's going to have an exit wave. There's no way they're going to stop it. And then eventually China did stop it, and then they got published this report, and they were still saying, but secretly they must have lots of cases that are going to start suddenly surging as soon as they let up. And so they're down to 0 cases per day, and people were still saying, but they're going to surge up again. And then they completely opened up. They are now completely opened up. And people working in China, they don't have to wear masks, they don't have to do physical distancing, you don't have to do anything. China didn't have an exit wave. Israel didn't have an exit wave. Israel has now got the imported Delta. That means they're going to start using some more restrictions again, like wearing masks, like better physical, better. I think they're closing their, and they're limiting the hours of their restaurants, I think, and things. Quite light measures, not hugely restrictive. So they may have to do that until they get a better vaccine. So Israel is asking for Pfizer to develop a Delta vaccine, and Pfizer is developing a Delta vaccine. So that's what you do. If you need to, then you keep the restrictions in place, and you continue to save lives, and you continue to postpone long COVID as long as you can, and stop long COVID, and then you vaccinate everyone you can to stop them getting long COVID. That's what you do with public health. You don't say, we'll let it happen now because it's better now than later. And public health, so in that thing I was listening to yesterday, the session yesterday, all the public health experts were saying, we have never seen a public health strategy like this before to deliberately let people get sick now claim that it's better to be sick now than later. That's just not public health. And one of them said that he has written that he believes this is actually murderous. So it's certainly negligence. Anyway, I don't think I think that's going a bit too far, because murderous implies intent to kill. And I don't think you can say that that's what they're doing. But I think definitely criminal is close to criminal negligence. So people who don't realise that they're endangering someone else's life, and they're careless to the point to which it really is no longer ethically acceptable to be that careless. And that's the level on which it is. They're saying that that Dr. Chris Whitty, he shouldn't stand there. It's gone a step too far. There's a step at which you just stand and say, I'm supportive, this is the politics and I'm doing what I can by way of medical health. There's a step beyond that where you start saying, well, what I'm doing is against my Hippocratic oath, so I have to resign. And the doctors saying, I just couldn't do that. I would not be against my oath to do that. Against everything I stand for as a doctor to support this strategy. So, and especially now, but I mean, just anyway, it's just deeply unethical, deeply immoral, as Dr. Mike Ryan put it. He called it moral emptiness and epidemiological stupidity. The moral emptiness is this thing, I think. He didn't elaborate. And he wasn't talking about UK particularly. Someone said to him, I've heard the UK is going to, on BBC, and the reporter was saying, what do you think about the idea of the exit wave now rather than in the autumn? And that's what he called. He said he doesn't believe that's what the UK's leading scientists are saying. And I don't know, I don't think the advisors are telling that, except our chief medical officer. And our chief medical officer is distancing himself from it. And he's saying that in the future, that we are ready for scary times. And he's contradicting Boris Johnson to an extent by that. But he should go much further. He should say, this is just not right. And it's just not what doctors stand for. We're there to save lives. We're not there to say, you can die now, it's better to die now than to die in winter, because we've got a flu season coming up in winter. That is just wrong. Totally wrong. Or said, it's better you have COVID now, because it is going to take quite a while to vaccinate you, and other people won't be able to go to nightclubs for a while if we wait until we can vaccinate you. And again, that's just wrong. That's not, just not right. That's not right. I do help people. Some of the people that I help, PM, and these scared people. Some of them are finding it difficult, being locked down. But the lockdown is a direct result of not doing the public health measures. And it's just like something. Scully, Dr. Scully called it like a blind man on a racing horse can see it coming. That it's not, and it's very similar to that. You can see the hospitalizations coming, because one of the experts from Israel, and he put it very well. There was 6 to 7% of the cases they found were hospitalized onto alpha, and with not vaccinated, were hospitalized when they weren't vaccinated. Now with Delta and with very high, 70% of their population vaccinated, something like very high percentage, it's gone down to 4 to 5%. So the way he put it is that you lose all that advantage of the vaccination in terms of hospitalization with one doubling. You more than lose it. So if the peak in cases was 76,000, I think, in January. If we go up to 150,000, we can expect more hospitalizations, and that is in the range of the projections of some of the experts. Then we can expect more hospitalizations than we had in January per day. and the NHS is already struggling. So we are in for a very rough time over the next few weeks. And we've already got so much baked in. I mean, today is 56,000, 54,000, for, as I said, and I wouldn't be surprised if Monday breaks the 60,000 cases per day. And the end of the week, probably at 100,000. And that's way higher. No, the end of the next week will be the 76,000, will break the record. And a fortnight, and then 2 weeks from now, will probably be 100,000. The way things are going, it just increases 40% a week. So that's very, very fast. 19. Just into August, is it? Yeah, just into the first few days in August is probably when we'll hit 100,000. But if it goes up like this, all bets are off. If it goes up like this, that's what happened in Netherlands, where it was already going down, and they opened the nightclubs. I mean, of course, I'm not sure if Delta was a factor as well, but that's what they were doing under Delta with nightclubs. That's how fast they were increasing. So if we increase that fast, then Christ knows where it's going to end in the next even in the next week. So I mean, we don't have quite the nightclub scene of Netherlands maybe, but probably some parts of the United Kingdom do. Parts of London or something may well get an increase like that. So, I mean, if it happens in the Netherlands, why can't it happen here? 5-fold increase in a week. And I mean, they don't have masks, and they had the discos going, so it depends on nightclubs. So it just depends how people behave. I think we might well already have had regions that have had a 5-fold increase in a fortnight. We might have a 5-fold increase in a week in some regions, if we are lucky. So just to be very, very careful. If you're in the United Kingdom, we don't know where this is headed. And there is a light at the end of the tunnel. We will get over this. And the immunity that you get as natural infection. So it's a bit of a puzzle. People don't understand why it is. You would think that the natural immunity would be better than vaccine-induced immunity, because your body has actually been dealing with the virus and all the bits of it for a week or so, and for 10 days, however it is, until the antibodies develop, and you would think it's that your natural immunity should be the stronger one. It doesn't work like that. The vaccine immunity is much stronger, at least twice as strong. And that makes a huge difference. And I don't know why really, but it might be because by presenting just particular units in the spike, it's training your body to really focus on that particular bit, and so be more effective at stopping the virus. That's one theory I saw. I don't really know why vaccines are more effective than actual infection, but they most definitely are. And so all these people are going to be infected. They still need to be vaccinated as well. And the disease, remember the vaccine is not effective enough to stop it spreading without other measures. So natural infection for sure is not enough to stop it spreading without other measures, spreading very fast. And so it can go through the population again. It isn't enough immunity to stop it spreading through again. Once everyone's been infected, then some of them will start being infected again, and the immunity is low enough so that will keep it going. And it'll no disease actually stops by natural immunity, but natural immunity plus the vaccines could stop it in principle if the vaccines were good enough and natural immunity was strong enough. But in the case of COVID, even the vaccines are not good enough, and natural immunity is nowhere near good enough. So natural immunity plus vaccines is not going to stop it. And we we're only going to be able to stop it with vaccines alone, with booster shots, with a much more effective vaccine that's one that's effective against the variants. We're not going to be able to stop it with vaccines alone, with just this vaccines we have already. We can stop it with the vaccines we have already, plus public health measures. So, anyway, I think those, I've added a whole lot more than I was planning to do. I hope this hasn't got too long. And to find out more about all that, there's this thread, and then there's the other thread, this thread as well. And then I link to my article there, and then that article, I'll put all that in the video description, where all these things I've been talking about. They're all in my articles that I've written recently in the last few days. And just to be absolutely clear, I'm not a source. So please don't credit me as a source in any manner or form on this. So please connect people to the experts like I'm doing. Please follow up these experts and learn what they're doing. And there are too many amateurs on Twitter sharing their theories and saying their and generating their numbers and saying things, and I definitely don't want to add to those. So try to connect you to please follow the true experts, follow the World Health Organization, follow the epidemiologists, follow the experts, and then the medics, those, and learn from them, and hope that I've managed to help connect you to some of this good information, and then I'll put links in my video description so you can go and find out more about all this.